Assalamu alaikum and good morning. I'm Abdullah Alahmadi, 201493, and this is my recording video for SBP 3117 about the endocrine disease. So, I'm going to talk about the thyroid gland. So, what is the thyroid gland? It's an organ. It's an organ located in the neck and wrapped around windpipe, the trachea. So, and it's shaped like a butterfly. Its function is to make hormones that control many functions in the body and release and control the energy. So this is the structure of the thyroid gland. Here we have larynx and the thyroid gland in the noddle. And under it is the trachea. It's between them, between the larynx and the trachea. So now we're going to talk about thyroid gland disease. There are two main types. There are more than two, but the two main types are hypothyroidism and hyperthyroidism. And so these diseases, the difference between them is making more amount of hormones or less of the T3 and T4. But we're going to talk about hyperthyroidism, which is making excessive hormones. And I chose this because it occurs in all ages. There is no such thing as old people get it and young people not frequent. So the causes of hyperthyroidism. The first cause is Graves' disease, which is an which the body makes antibodies against viruses and bacteria that is called TSI. So on this condition, the thyroid hormones will be excessive. Also, toxic nodular. So these nodules in the thyroid gland cause the thyroid gland to produce excessive amount of thyroid gland. And there is also inflammation of the thyroid gland that results in virus and immune system problems. And the last cause is on diet, what people consume. If some people consume too much iodine, so that would make hyperthyroidism. So the symptoms of hyperthyroidism. The first is rapid heartbeat, commonly more than 100 beats per minute. Second is irregular heartbeat. Third, pounding of the heart. And the fourth one is increased appetite. For the increased appetite, it happens, but the people with hyperthyroidism, they mostly lose weight. It's not always like that, but from what we see. And after that is being nervous, anxiety, and irritability. Then tremor, which is trembling in your hand and finger. The last two are sweating and changes in the menstrual pattern. This is for females. Now, the diagnosis for hyperthyroidism. The first one, which is taking iodine by the doctor. What this does is it helps the doctor to see how much of iodine does thyroid gland take. for the body. So this will indicate if the thyroid gland is taken much or not. And the other one is blood test to measure the levels of the thyroid gland. Okay, now we go with the treatments. There is first one is beta blocker like propanol, which control many symptoms of hyperthyroidism. It slows the heart rate, reduces tremor, and control anxiety. The second one is anti-thyroid medication. This medication also prevent thyroid gland from producing excessive amount of hormones. It's like the first one, but it doesn't focus on the heart rate, tremors, and anxiety. And the last one, which is more for pregnant women, because some pregnant women can't take can't take medicines since they are pregnant, so they make a surgery. But the problem about this surgery, it may cause a vocal cords and parathyroid. It may cause a damage of the vocal cords and parathyroid gland. All right, thank you. That's all from me. Salam alaikum.